In this presentation, we're going to discuss everything that you need to know in order to be able to do your sports massage treatment. So this is the theory behind the sports massage treatment. So the history and development of how sports massage came about. We're going to discuss what equipment you need to do the sports massage, what mediums you might use, the movements and what they do, how you do the treatment, how you put it all together, what else you might use within your treatment, so stretching and different types of movements. We're also going to be discussing pre and post event treatment and its purpose, the possible reactions that somebody can have to the treatment afterwards, what home care advice you're going to recommend, and what stretches you're going to recommend that the client does. So this is the theory behind the sports massage treatment. So the word massage is derived from the Arabic word meaning mass, so meaning to press softly. The Greek word massien means to knead, the French word masseur meaning friction or kneading on the body, and the Portuguese word amassar to knead. So they're the history. I mean, the history of massage goes right the way back to Chinese dynasties, and before that, there are records of all nations doing some form of massage. The history and origins of massage go right the way back to Chinese times, 2700 BC, where we can find detailed writing about using massage as part of the Chinese medicine. It was the Greeks, though, that brought the massage to the West, and Hippocrates, a famous Greek, wrote referring to the art of rubbing, which was very good for loosening and softening muscles. The Greek women regarded massage as part of a beauty regime, and exercise and massage combined were also believed to address the whole of the person, not just one area. So even going back as far as Greek terms with Hippocrates, we've got this holistic approach, treating the whole of the body instead of just one area. Continuing on, we've got the Romans. The Romans were definitely before their time. Galen was one of the greatest Roman physicians who learnt to massage and treat diseases and physical injuries with massage. He contributed to the development of the knowledge of anatomy and physiology, and he wrote that massage eliminates waste products and the poisons of fatigue. Julius Caesar had regular massage and was even birched with twigs in order to eliminate poisons as well. So the Dark Ages, between 1450 and 1600, massage therapy reached Europe and medical schools were established. Ambroise Paré, a French doctor and founder of modern surgery, started using massage to treat stiff and injured joints. So we can see that massage has been around for an awful long time. Per Heinrich Ling is known to be the father of massage. He was around in the 19th century. He was a Swedish physician, and he developed the Swedish massage technique and used it with Swedish gymnasts at the time. Ling has often been mistakenly credited for having invented Swedish massage, but apparently before him, Johann Georg Mesger was who invented and termed the phrase Swedish massage. However, it was the Ling Institutes that were set up in Sweden that pushed massage forward, and a lot of our British doctors went to train under Per Heinrich Ling. So just to remind you that Johann Georg Mesger was 1878. He was Dutch, and he termed the phrase Swedish massage. He applied French terms to the name of 5 classical massage techniques that we still use today. Massage is recorded all over Europe, but it was the Finnish school of massage in 1900 that developed the first sports massage. And it was during the Paris Olympic Games in 1924 that one of the athletes credited the special massage treatment that he had as being the most important component of his training. It led to Paavo Nurmi winning 5 gold medals in one day with only a 30-minute break between some events. So even back in 1924, the Olympic Games was providing massage for their athletes. Moving on from the Olympic Games then, in Russia, Sarkisov Sirasini in 1924 to 1930, he formulated a Russian sports massage, which he taught at the Central Institute of Physical Therapy in Moscow. In 1950, competing Russian athletes had a strong ethic of having massage as well as training, and they were supported by the Soviet government. Extensive research programs and proven techniques were used in Russia then as well as today, and many European countries embrace sports massage as part of a recipe for athletes to win. Development of sports massage came about in America by Jack Meagher, who's considered the father of American sports massage. During World War II, a German POW gave him a massage, and since then he developed and coined his term sports massage and used anatomy, physiology, and pathology to develop the Meagher method. In 1970, he used his techniques on the Olympic equine team with great success for the riders and the horses. And in this country, we have equine massage for horses, which is very, very popular and very effective. So in 1980, Jack Meagher wrote the first sports massage book. He wrote a book called A Complete Program for Increasing Performance and Endurance in 15 Popular Sports. So in America in particular, he was a big name in developing sports massage. The American Massage Therapy Association was established in 1985, and they created a national sports massage team. This team provided massage for the Boston Marathon runners, and sports massage in America is considered a special massage therapy. These days, along with sports massage, a lot of therapists use acupuncture. This aims to deactivate the sore muscle knots that can create chronic pain within the body. It stimulates the local healing process and the imbalance in the tissues, reduces inflammation and decreases the pain to restore function. So quite often, sports massage therapists will use acupuncture in conjunction with their treatment. I use aromatherapy alongside my sports massage. I find it very useful when you've got antispasmodics you can use, and analgesics, pain relieving oils that you can help assist in the recovery. I also use stone therapy because ice is very good after an event. The cold stones, particularly the marble stones, are excellent for draining lactic acid. But we can also learn as a sports massage therapist how to do a pre and post event massage. So we can go along to a marathon, set up in the tent and do short but fast and brusque pre-event massage. And then after the event, we can do nice, slow, flowing massage as a post-event massage. Also, in between treatments, in between runs, a client can use us as part of their training procedures to make sure that they recover quicker and they are in peak performance before they actually try and do their event. Sports massage therapists can provide massage once the client has completed their initial curative treatment with their physiotherapist. I've worked very much with physios and chiropractors and osteopaths over the years, and medical professionals tend to provide treatment up to a point but only to help a specific injury. And when it's recovered and past the acute stage, then we can often take over. They'll not often review a client or look at other potential dysfunctions in relation to long-term treatment, which is where we can come in. A sports massage therapist can help to continue breaking down adhesions, developing the flexibility of a joint and muscles. We can improve the mobility in soft tissues, continue the improvement and recovery, and avoid the recurrence of an injury again. So we can do an awful lot to continue the treatment that's been started by other therapists. If you're working in the sports industry, you might not have a clinical setting. You might not have a clinic room set up. You might have to do treatments in a non-clinical setting on site. Quite often, a lot of the sports massage therapists go into working with, I don't know, the Chiefs, Exeter Chiefs. I've got a couple of therapists that are working with them. You might be working with Formula One. You might be working on site in a ski resort where there's not exactly clinical settings. It could be a sports event. It could be within a clinic environment, but invariably you may be going out and about where you have limited resources. So maybe a portable couch, as there is in this picture. You might have a gel or cream that you use rather than grapeseed oil, but you don't need a lot of equipment to actually do a sports massage. And as you can see in this picture, unlike the eye-tech requirement for you to still cover the areas you're not massaging, in reality, you may not even have time to cover up the rest of the body. Your aim is to actually get in there, sort out the muscle, and alleviate the problem for the athlete. So when you do pre-event massage, you're going to treat the whole area and not just overwork one area. Avoid using relaxing strokes unless the athlete is really nervous. So the massage should not be used unless the athlete's used to it, because if you can just imagine having a pre-event massage for the first time, you're all geared up to have a run, you're not used to having a pre-event massage, it can change the way that you perform. So make sure that the therapist has plenty of practice of a pre-event massage on athletes first. The benefits of pre-event massage is that it stimulates the mind and body. It ensures that the athlete works at peak performance. It's part of the warm-up routine rather than a replacement. It improves flexibility. It prepares the muscles and nerves to coordinate for the event. Stimulates the circulation, getting oxygen and nutrients into the cells, removing lactic acid and preventing cramp and stiffness, and vasodilating the tissues, so keeping them nice and warm. So there's lots of benefits to having a pre-event massage, and it's important that you understand what those benefits are so that you can sell a pre-event massage to athletes. During your pre-event massage, you're going to use oil. You're going to warm up with effleurage and petrissage, but not too much. You're going to use compressions, percussion. The maximum muscle stimulation and invigoration is what you're trying to achieve, using brisk, rapid strokes. This is what I would call the quick step of the massage. So it's got to be quick, vital, and stimulating and invigorating. I use massage in between events for my runners and marathon runners. It helps them get over any micro traumas they might have had, any fatigue, lactic acid crystals, and using a medium amount of pressure, specific movements for them at the time, so specific to the client, and it helps them recover a lot more quickly from any problems due to that event and prepare them ready for the next event. Post-event is a slow, waltz of a treatment, usually performed within 2 hours of an event, 3 to 4 times more effective in preventing muscle fatigue than anything else. It prevents future injury as well, brings a faster return to the training program, cleanses the body and eliminates waste products, promotes relaxation in the body and the mind, efficient recovery, and it stimulates the healing process. The aim is to keep the muscles in prime condition, so the movements are going to be a slow rhythm, maybe compression, effleurage, connective tissue massage, petrissage, and frictions, but certainly nothing invigorating or stimulating. Maintenance massage is a term given to any treatment really that happens in between events, especially when it's out of season, and the aim is to keep the muscles in prime condition, improve the blood and the lymph drainage, make sure the tissues are more supple, enhancing the flexibility and therefore the performance of the athlete, forms part of the athlete's training program and pinpoints and treats problem areas as they arrive in the very early stages. So the sort of treatment movements we'd be using would be compression, effleurage, connective tissue massage, petrissage, and frictions. This is one of my treatment rooms. So I want you to consider what your treatment room is going to be like, what the lighting and heating is going to be, where your reception would be, the ventilation and the space that you require. You certainly need to be able to get around your couch or your plinth. What equipment do you need? The general hygiene, especially now during COVID. This picture's got a couch cover on it, but at the moment I've been using the vinyl and a vinyl roll bolster so that that's more easily wiped down with sanitization liquid in between clients. We seem to have foregone the pillows with pillowcases and mats. We tend to use something much more hygienic, lots of paper that we can dispose of safely and hygienically. So where are you going to put your waste disposal? You're going to have a bin, pedal bin with a lid that you don't have to touch, that you can line with a plastic bag so that you can tie up your waste. Make sure you have lots of hand sanitizer and that you've got masks available for those who haven't had all their vaccinations. What's your decor going to be like? People do generally not take too much notice of their environment when they're having a sports treatment. They just really want to get on the couch and have the treatment. But for future treatments, it's certainly worth thinking about having a fairly comfortable environment, warm, soft lighting. What are your reception areas going to be? What privacy are you going to offer? What about the bathroom if somebody needs to go to the lavatory? Are you going to be in situ at an event, in a tent? Are you going to have screens? What are you going to provide when you go to an event? Consider the environment. Do a risk assessment so that you can check that everything is safe and nothing is untoward is going to happen. Make sure that the area is suitable and you can adapt to your environment with whatever equipment you need. So if I'm going to another venue, I will take everything I need, my wipes, my sanitizer, my foot wipes, clips to put up the hair if necessary, paper roll, my couch, a stool to help people get on and off the couch if they're have a few problems with mobility. So a plastic bag for rubbish. So everything I need, I take with me. And you need to consider the environment that you're going to do sports massage in and where it's going to be. So we're going to think about what equipment we need. We certainly need a couch, a plinth, or a bench. We need towels. You need something to cover people with. Now, this could be towels or this could be disposable towels you can get now, or covers. I tend to go for the IKEA throws. There's a grey throw. They're £1.79. They're really warm. They wash easily. can have lots of them, and they're in the washing machine and drying in no time at all. Support pillows or a bolster, as I said, you can have a vinyl bolster which you can wipe over with your sanitization fluid. Couch rolls are very useful for anything that can't be cleaned easily. Like if you do have a pillow of any sort, you can cover it with a couch roll. The massage mediums you can use could be oil, could be traditionally talcum powder for a small area or a hairy client, or you could have a cream or a gel if it's a small area. Sport specific mediums, have a think about things like biofreeze. It's a very cooling balm, or you might have a hot or cold balm or gels. You might want heat pads, ice packs. And because of COVID, you definitely need to have sanitizing fluid, face mask, plastic apron, face shield. Think about the PPE that is being recommended at the time by your professional body or by your tutor. Traditionally, massage was done with unperfumed talcum powder. I find it very clogging to the skin, though I don't like using talcum powder at all. Although iTech recommend that you use talcum powder for oily or hairy skin. So do make a note of that just in case it comes up in your exam. You can use creams, emulsions, gels or lotion. They're very good for dry skin and the face, but for small areas, not for large areas. I tend to go for a vegetable oil. But if you do get a vegetable oil, make sure it's not a mineral or blended oil. It needs to be a cold pressed oil. Grapeseed is our preferred oil. It's cheap, it's got no smell, very few people are ever allergic to it, and it's cold pressed. So that means it's not sticky or cloying on the skin. It goes into the skin and is a really nice medium. So you don't want too much oil. It's better to be on the airing on the less rather than too much. It's hard to take it off if you overdo it, and you certainly don't want your client's limbs slipping and sliding like a wet fish. Do be aware that some clients have sensitive skin and you may have to do a patch test. Now, a patch test would be done inside the upper arm, above the elbow, where the skin is the most sensitive, and you would just put a little rub of whatever medium you want to use and see if it erupts in a red rash or irritation. Usually you would leave it for 24 hours, but if it's going to erupt, it normally would do that a lot quicker. So have a think about your mediums. As I said, most of us use grapeseed oil, but we do often have an emulsion or a lotion, and I have a white lotion I use for small areas. When somebody has a massage, particularly the first massage they've had, they will often have a possible reaction to treatment, and there's a variety of things that people can suffer from. I think the most common one is that they feel absolutely knackered, tired to death. And that generally is because of the detoxification. Because of us moving around the body, stimulating the circulation and the lymph drainage, this is very, very tiring. And that can be relieved most quickly by drinking lots and lots of water. So you may find that your client feels absolutely tired, and if they do, then it's a good sign because we've done a good job, but we do need to make sure that they have plenty of water. They might feel that their muscles are sore where we've been working on, and they might even suffer from cramp, but this should go away within 24 hours, and if they need to take a pain relief, then that's fine. If you work to the VAS pain scale of 1 to 10, you shouldn't get too much muscle soreness afterwards. So I would be encouraging my client to give me a number throughout the treatment of what the pressure's like and how painful it is for them. Working at a 7 is my pleasurable agony. So making sure that we work to the client's pain threshold is vital to reduce the muscle soreness and cramp they might have afterwards. Inflammation or cold-like symptoms. Well, I've never had this sort of symptom myself, but I do know that the body doesn't really like being stirred up a bit. So you can feel as though you feel a bit poorly after a treatment. What we do though is we increase the blood supply to the area that we've worked on, and this is called erythema. And erythema should be a temporary redness, and it should go down within about 20 minutes. It can also mean that you get a bit itchy where the blood has rushed to the surface. If you've worked quite firmly on the neck or the back of the head, a client might suffer from headaches. That would be quite a normal reaction for somebody who's particularly stressed or tense. Frequency of micturition is going to the loo, having a wee. So micturition is the proper term for urination. You can increase micturition, especially if you've had a really good lymph drainage effect on the body. Increase of bowel movements. If you've stimulated the stomach in some way, you might increase peristalsis. Client might be thirsty, and this again is the detoxification and the lymph drainage effect. So you would recommend your client have plenty of water post treatment. They might have heightened emotions, and this is where if somebody is hanging on to their tension, afraid to relax too much or let go, they may end up having an emotional outburst. That's quite normal after a treatment. All of these possible reactions to treatment are because the body is having a bit of a healing crisis. It's a good sign, but you need to make your clients aware of the possible reactions to treatment without frightening them to death. So when your client comes back for your second treatment, you normally would ask them how they felt last time. And you're going to ask them how they felt. And when they give you that feedback, you might change what you do. You might change the techniques you use. You might change how you're working on the client, what areas you work on. You might certainly are going to change your pressure. If they had an extreme reaction, then you might ease up on the pressure, or you might ask them to be a bit more realistic in their responses to the pain threshold they're telling you about. You might also decide to do a slightly different approach to the treatment. So communication is the key, and you do need to make sure that your client is honest with you during the treatment. You might adapt the technique to suit the client's needs. You might get them to do more stretching to ease cramp. You're certainly going to reassure them and advise the client in response to what they've said. After the treatment, you're going to warn the client of the possible reactions. You're going to advise them of strategies they can use at home, maybe an ice pack, a hot pack, contrast bathing. You might recommend that they use a tennis ball for massaging their own shoulders for their own self-help. Certainly going to recommend rehydration, rest, and reassurance. So there are 5 different classic movements that we can use with our massage, and we're going to always warm up with effleurage and finish with effleurage. Then we're going to build up to petrissage, frictions, maybe use toppement or percussion, like cupping, hacking, beating, and pounding. We might use vibrations, stretches, maintenance and development moves like sort of active, passive, and assisted moves. So our treatment is going to be a combination of all those different movement types. One of the biggest criticisms of sports massage today is that the therapist goes for gold and does not warm the area up sufficiently before using firm pressure. And effleurage should never be skimped on. We should be warming up the muscles with our effleurage using the palm, the flat of the hand, or the ulnar border. This can be light to the touch, superficial, or it can be deep and draining. But whatever you do, start off light and build up to a more deeper and more draining effleurage. This introduces the therapist's touch and is used as a linking movement throughout the body. So the pressure is always towards the heart, and we're looking for a ripple like we've got in this picture. You can see just in front of my fingers, there's a ripple of flesh. Now that tells me that my fingertips are firmly down on the client's body so that I can push and apply pressure and offer that ripple. So the examiner will be looking for a ripple when you do your effleurage. Now, there are physiological and psychological benefits of effleurage, and the physiological benefits are that it improves circulation, improves the skin tone, increases the lymph flow, and aids desquamation. Desquamation is the sloughing off of dead skin. If it's done slowly, it's sedating, and if it's quick, it's invigorating. Psychologically, effleurage induces well-being, is relaxing and soothing and calming, and gives your client a sense of well-being. So having warmed up the area really well with effleurage, stimulated the circulation and lymph drainage, we're going to move in with petrissage. Now, petrissage is any movement that we manipulate tissues. Rubbing, pulling, frictioning, kneading, using pressures, wringing, knuckling, all of these sort of movements are a form of petrissage. So we might compress. The rule of thumb is knead where it's needed. So the more flesh we have, the more kneading we do. And kneading is to release muscle stiffness and tension. Psychologically, it's a combination of relaxing and invigorating at the same time. Physiologically, we're going to increase the blood supply, break down and aid toxin elimination, break down fatty deposits. We're going to relieve muscle spasms, especially after exercise, and prevent stiffness. So petrissage is the second movement that we might use in our portfolio of movements. Percussion, also known as topotment, is brisk, invigorating, sort of striking the body. So this is cupping, hacking, beating, pounding. Topotment is where you use the tips of your fingers on the face, stimulates the nerve endings. It stimulates circulation, warms the skin, improves muscle tone, but is contraindicated too much in bony clients. Physiologically, it's going to stimulate the nerves and improve the muscle tone, reduce fatty deposits, loosen the mucus in lungs. It draws the blood to the surface, and you might get a little erythema, which is a temporary rush of blood to an area. Psychologically, it's a stimulating move. You do need to practice this before you come to class rather than smack 7 bells out of your class and make them feel as though they've just been thumped. So we need wrist flexibility with percussion. So we need to make sure the elbows are tucked in, and instead of using a long rigid arm like a puppet, we're going to use the wrists and keep the hands relaxed. So although hacking is like a relaxed karate chop, it is certainly not anything like that on the body. It's very relaxed. So practice your percussion before you come to class. Vibrations are when we shake, tremble the muscle and make deep oscillation movements. If petrissage and frictions are not releasing the tension, then firm vibrations at the end of the treatment to the muscle can be really effective. It releases tension, warms the tissues, improves blood and lymph flow to the muscles, and increases the local vascular circulation. So physiologically, it's relaxing, warming the tissues, restoring and maintaining nerve function, and psychologically it's releasing tension. So it's done with a static hand, and I'll show you how to do vibrations. Connective tissue massage is a form of stretching. It's a very useful movement for stretching the skin. It's done quite lightly, not as firmly as a lot of therapists can do. So it releases the trapped fluid in tissues between the muscle fibers. So it can't be too firm if that's your aim. It is very good for relaxing adhesions and breaking down adhesions, especially where there's been an injury or after an operation. You don't necessarily need a movement to use a medium, rather, to use this movement. You can use the tips and the pads of the fingers, or you can use the side of the hand or the heel of the hand. So for short distances, you might use the middle finger and push it along the muscle, picking up the slack of the skin and stretching it before you release it. For long distances, you might use more fingers for longer length strokes before you release it. And I will show you what this looks like in the classroom. Cross fiber frictions is something I would use on soft tissue where there's bone underneath. So it'll get me a deeper pressure, it'll focus on a small area, and it helps to break down knots like fibrosis or adhesions where there's been scar tissue. It stimulates the circulation, promotes healing. It has an analgesic effect. It stimulates the body's natural endorphins, which relieves pain. So it's usually done with the fingertips or the heel of the hand, but generally it tends to be the thumbs or the fingers, quite fast and rapid cross-fibering across the muscle. So usually where there is bone underneath. Compression is one of my favorite movements, especially if you're going to do it on site. You don't want clients to take their clothes off. You can have an enormous amount of benefit on releasing muscle spasms and strain of muscles with compression. You could do a rhythmic compression or you could do a static compression. So rhythmic compressions create deep hyperemia, so get the blood flowing, softening the effect in the tissues, warming it up for deeper work or more specific massage. The pressure applied can be pushing the tissue against the bone, sort of like using the heel of hand or the fist, or you can be using the forearm with a pumping effect, assisting the circulation. So compressions have a really big place in sports massage. So generally, when you're using these movements, you need to understand that your technique is a combination of these movements. So there is a logic to the treatment that you're going to do. You start with effleurage, you finish with effleurage. Your movements are going to get deeper, they're going to be logical. Moving from one area to the body, you're going to use effleurage to move. The least you take your hands off the body, the better it's going to be for the feel of the treatment. So the sequence is logical. The pressure is going to be consistent and appropriate with the area that you're massaging as well as the movement you're using. The direction of the movements is always going to be towards the heart. And when you come back from the movement, it's going to be lighter and it generally is going to drain to lymph nodes. The speed is adapted to each type of movement as well as to the client's needs. And the rhythm is going to be regular and flowing. So the skill is in keeping the touch, maintaining the contact, moving the limbs for the client, so not waking them up every 5 minutes, asking them to move here, there, and everywhere. And also being confident, even when this might be your first treatment. If you come across as confident, then your client will be confident in your ability to do the treatment. And quite often, we're a lot better than we think we are, even from the very beginning. What are the effects and benefits of massage? So physically, we're definitely going to stimulate the circulation. We're going to improve the skin tone, improve the muscle tone, drain the lymphatic system, release toxins and waste products, break down adhesions if there are any. We're going to release muscle tension. We're going to reduce pain. So psychologically, we're going to promote relaxation and induce a feeling of well-being. So we have 3 types of stretches, and you will be required to research different stretches to help maintain and develop the benefits of your sports massage. So there are 3 types of stretches: there's active, passive, and assisted. And the active stretches are done where the client uses a prop to resist a force in order to extend the stretch. So for instance, maybe linking a towel or an elastic over the heel to draw the leg into a deeper hamstring stretch. Passive stretch is where a client is instructed to relax the muscle and the practitioner moves the joint through its range of movement to a comfortable limit. An assisted stretch is where another person is manipulating your body while you try to relax your muscles.